right. Thank you, everybody, for joining us. Would like to welcome you to the 2020 Lakeville Public Safety Public Service Announcement Update. We would like to update people on the operations of public safety in the town of Lakeville. I'm Matt Perkins. I'm the Chief of Police. I'd first like to start off with talking about the current civil unrest regarding the death of George Floyd. Everybody's outraged, and I just want everybody to know that I am personally outraged. Everybody at the Lakeville Police Department is outraged. That isn't something that reflects upon police officers across the country. It was some rogue police officers in Minneapolis that committed a crime, tarnished the badge, and caused a lot of the civil unrest across the country. The message was put out by Mass Chiefs of Police Association that they denounced the actions, the egregious actions of the 4 Minneapolis police officers involved in the death of George Floyd. And that is the statement and the sentiment that we here at the Lakeville Police Department agree with. It was egregious. It was something that we don't practice. And I just want everybody in the town of Lakeville to have confidence in the police department. I got an email from somebody asking a series of questions, and I'd like to answer some of those questions with some of the things that we practice here at the Lakeville Police Department. Some of the things that are different from Massachusetts as compared to other states, we are required as police officers to conduct a minimum of 40 hours training every year. Part of that training is a mandated requirement that we do 8 hours of defensive tactics training every year. That defensive tactics and the tactics that we use by the Minneapolis Police Department are not taught through the Municipal Police Training Committee in Massachusetts. We don't teach that. We don't kneel on someone's neck for 8 minutes and 46 seconds. We don't do that. We restrain people, but not in that manner. There will always be a need to use force in police work, but we do it responsibly. We do it according to policy. We have a use of force policy. Nowhere in our use of force policy would those actions that Minneapolis police officers did, they wouldn't conform with the policy of the Lakeville Police Department, and they wouldn't conform with any policy anywhere that I know in the United States. We do forms. Force is used force. It gets reported. It gets documented. So there would be accountability if someone did something like that in Massachusetts. Last year, part of the mandated training that we did through MPTC, the Municipal Police Training Committee, was training called ICAT, or Integrated Communications Assessment and Tactics. It was a one-day training, and it was all about use of force and de-escalation. We don't want to, it's a lot of times police officers escalate things to use force. And this training was good, where police officers are taught how to de-escalate, how to bring a volatile situation under control with proper communication, proper assessing the situation. Is this person having mental health problems? Is this not a crime that this person is committing? Is force justified? And that's important, and it's training that is taking place, and maybe it should have been done, and it should be implemented every year, that type of training. But it is every year. We do use of force training, and every tactics that they teach is something that is justified. And our philosophy here in Lakeville is, we follow the 21st century policing model. President Barack Obama led a briefing. I happened to go to the White House in 2016 to be part of one of the briefings. And the final report has 6 pillars. The first pillar is building trust and legitimacy. And the whole philosophy behind that pillar is if the community trusts you in what you're doing, then they have faith in you. There's been studies that show citizens who have no faith or trust in the police department will not trust or believe in your authority. That leads to crime. And you see that with the looting and the riots that's happened in the big city, in Minneapolis. The people of Minneapolis lost their trust in the police department's authority, and what you had was crime. So to have proper crime control, you have to have proper trust and authority. And that comes with transparency. It comes with accountability. A lot of it has to do with the guardian versus the warrior mindset. And that's something that it's changing in law enforcement across the country. A lot of departments, a lot of mentality is, okay, you're a warrior. You've got to go out there and find the bad guy, and you're at war with the citizens trying to identify these people, where that's not the case. We're guardians of the people. Yes, we do have to encounter and find the criminal, but it's the mentality of it, and it just builds trust, and it gives you legitimacy when you kind of change that, where you're looking out to protect the citizens and not going out there and thinking all the citizens are bad. Pillar 2 is policy and oversight. We at the Lakeville Police Department are in the self-assessment phase of the Massachusetts accreditation program. All our policies that we're implementing are reviewed. They're nationally certified by CALEA. They have input from stakeholders, and we just don't make our own policy. They're tested, they're reviewed, and they're reviewed annually to make sure that they can conform with trends. If there is a crime committed by a member of the police department, we will take care of any complaint. We investigate all complaints. There is accountability for any police officer who could be accused of something. But if there is a crime involved, that we don't investigate our own, if you understand what I'm saying. We refer that to the DA's office. A lot of people look at a police department and say, well, you investigate your own and you don't do anything. That could be true, but when it's something of a criminal nature, we don't investigate our own. We give that to the DA's office. It's investigated properly. That's part of oversight. Part of the 21st century policing, they do have community groups, peer reviews and stuff. We don't have that here. Is it something that could change? It's a possibility. There's probably going to be a lot of changes and stuff with all the protests across the country. You'll see, we just did Massachusetts criminal justice reform 2 years ago. Could there be more reforms and more changes throughout policing? I'm sure it's coming. Pillar 3, technology and social media. The big thing about technology is body cameras. You can see right here, I'm wearing a body camera. We've had some type of recording devices in some capacity in Lakeville since 2006. Right now, we have cameras. We have one dedicated full-time officer who wears a camera. I wear a camera when I'm out there doing enforcement activities. And then on radar patrol, we have an officer who wears a camera. Right now, it's kind of just, we're in a phase waiting for some guidance from the state to determine the use, proper policy, public records, retention. So there's still a lot of questions regarding the use of body cameras in Massachusetts. Other states have them. They're more widely used, but I think some additional changes coming. We're only right now that I know of one of 7 municipalities in the state of Massachusetts to be using body cameras in some fashion. Also, part of the technology is less than lethal technology. A lot of departments don't have any less than lethal. Every officer on the Lakeville Police Department does have less than lethal forces, so they don't have to resort to a firearms to protect themselves. We do have tasers, we do have pepper spray, and those have been useful in subduing someone where they don't have to go to their firearm. And that is a last resort. Additional parts of technology is upgraded interoperability communications. We have a brand new police station here. We are doing police and fire dispatch. You can see that we have new radios coming in. We're going to a microwave system. I think everybody's excited about that. It's going to improve our radio communication. It's going to improve our communications between police and fire. And that just is better response times. It's safe for the officers, and it's safe for the public to have proper communications, and we have that common. Community policing and crime reduction is pillar 4. And that is big. It's always been big with the Lakeville Police Department. We partner with the community. When we have a successful partnership with the community, it helps in reducing crime. We've had the Citizens Police Academy. We've run that for 20 years. Obviously, we would be running one right now if it wasn't for the coronavirus, where we can't gather. But I think once we get out of this, maybe we'll do one in the fall. And I encourage everybody to come out and take part in the Citizens Police Academy. It's 8 weeks long. We run it one night a week for 2 hours. We tell you what we do, and I think that's important. There's no mystery of what law enforcement is, and we encourage you to come out and take part in that. We also do programs like Coffee with a Cop. We've gone down to Dunkin' Donuts. We go to the senior center. We've gone to Something's Brewing Cafe. We advertise it. People come in. We drink a cup of coffee with them, and they tell us their concerns. If they had concerns about, okay, hey, this happened with a use of force situation in a different state, I'd like to know why that officer did that. We can, if it was legitimate, we can explain it. The stuff that happened in Minneapolis, that wasn't legitimate, and you can't explain that. That guy was a rogue police officer. And that's what we'd tell them, and that's what we say. And people might get confused that we're all the same, and we're not. We take part in multiple community events. We're out there. We try to get ourselves involved in the different programs around town. We do the Lions Club every year. We set up a table. We try to do information. We did a bicycle helmet safety last year. People come up and they talk with us, and that's what we want. We don't want to be vilified like we have been recently. We want to be engaged. We want to partner with the community and let us know what your concerns are. And that's the same thing when we do High Five Friday when there was school going on. We'd go out and we'd give the kids high fives. It makes us more approachable. It builds relationships with the youth in town, so they know they can come to us with their problems, because right now, our reputation, people don't want to come to us, or the evil policeman. Look what they did to George Floyd. And I don't want that to reflect negatively on the Lakeville Police Department. Pillar 5, training and education. Higher education for law enforcement. And this is something that was in that, that was looked at. And in Massachusetts, we have the Quinn Bill, where it's an incentive to go out and get educated. It's an incentive to go out and, further your education. And that just makes us better police officers. It makes us more professional. This is our profession. I'm proud of my profession. I have, a degree. We all have degrees here at Lakeville. We take our job seriously, and it's important. Other parts of training and education, it was recommended in the 21st century briefing that every police officer starting out should have some type of implicit bias training. And that's important. And when you're coming on the job, to understand what that is. And I think that's definitely going to be probably implemented in every police academy across the country. Pillar 6, officer wellness and safety. That's important. This is a tough job. Police officers can have a bad day. You might catch a police officer on a bad day, and you might think, oh, that police officer was a jerk. He gave me a ticket. And, we try to see that in other officers. Hey, what's wrong? Why did you treat that person that way? And they all, why are you having a bad day? And we try to get, that person help. We have access to the CISM team, or the Critical Incident Stress Management team. So if someone does have a critical incident and they're suffering from, post-traumatic stress, or they were involved in a stressful situation, that can have effects on a police officer for a long time, and they could take it out on the public. And that's what we have, each other's back, and we say, hey, go talk to somebody. And we try to do it confidentially, where, people think, oh, it's the policeman, he's supposed to be tough, and that might not be the case, where that person, could use some assistance. But we are always looking for police officers who are having a tough time, and we get them some help. This doesn't have to do with Minneapolis police officers. From what I heard, he should have been identified and maybe not have been a police officer. We do that. That's done through accountability, and it's different than dealing with stress. We don't take stress out physically against the public. It's not the way it works. And the reaction and the mentality that everybody thinks, the bad policeman, and the vilification of law enforcement officers across the country is tough. I try not to take it personally. And officers here try not to take it personally, because we do want to have a good relationship with the people in town. We're here to protect you. We're here to serve you, and to give you the best service that we can. But it's, like I said, it's happening across the country. Those officers tarnished the badge. They, blemished my profession that I've put a long time, a lot of effort into. And, we got to try to repair it and do the right thing. And I want everybody in the town of Lakeville to know that they have a good police department, a professional police department, and that we have your interest at heart. All right, that was my George Floyd statement. One crisis after another in 2020. So we're going to go to the coronavirus things. So we've seen a lot of things happening with the coronavirus in law enforcement. When this first hit, there was a lot of predictions and projections that we would see a rise in domestic violence and like sexual assaults. And that's because people were confined in their house. We have not seen it statistically in Lakeville. There are some pockets across the state have seen rises. Some have stayed the same. Some have gone down. From March 1st to June 11th, I ran the statistics on all restraining order violations, all restraining order service, all family disturbances, all domestic disputes, and domestic assault and battery. From March 1st to June 11th in 2019, so this is last year, we had 59 of those incidents. March 1st to June 11th of 2020, so, the course of the coronavirus, we've had 55. So we're actually down 4 incidents of domestic violence since, as compared to last year. So it doesn't look like it's a problem, but that doesn't mean people aren't reporting it. Some people are afraid to call. Some people are nervous to call because they don't want someone coming to their house who could potentially infect them with the coronavirus. And I think that might be the same for the fire chief and the fire department. Might speak to it too, where their normal calls for the ambulance are down because people don't want to go to the hospital because they could infect themselves with the coronavirus. So there could be a little bit of the same mentality going on. So if you are a victim of domestic violence, you are in fear, there is help out there for you. And I'd like to turn it over to Lieutenant Linus, who's going to talk to you about how to apply and get a restraining order.
Okay. Sorry. Okay. So the state has set up numerous ways for someone to get a 209A or a restraining order. The easiest way is to call us. And if anybody's in danger or any imminent harm, I mean, just call 911 and we're still coming. So the ways you can call us for information on how to obtain a restraining order, you can call the court that you're in your jurisdiction. You can, the state has a SafeLink 24-hour statewide hotline, and that's 877-785-2020. And they have advocates online that can lead you on how to get a restraining order. So the state is still issuing restraining orders. There hasn't been any cease to that. As a matter of fact, when this all started, they really didn't know what to do with them. So all like the 10-day orders and expiring orders were just extended, just like they did everything else. They're starting to get caught back up now. JaneDoe.org is another one that you can find out. But I mean, the easiest way is just to call us, dial 911 if you're in danger, and we can work you through it. A lot of it's being done virtually through Polycom or a Zoom meeting or a conference call, but they are getting done. It has not stopped.
Thank you. That kind of, do you have any questions about a restraining order? Anyone on the panel? I know some of it you can do on an emergency basis after hours. You can call us. A restraining order, for those who don't know what a restraining order is, if you get the order, you get the order granted. The person that you are in fear of, if you live with them, they can vacate the house. They have to vacate the house. They have to not, refrain from abuse, refrain from contact. They can't send you any cards. They can't call you. If they do, then they get arrested and held without bail until the next court day. So there is help out there. If you do have any questions, don't hesitate to call the Lakeville Police Department, and we can walk you through, what a restraining order is and how to get help. Also, one of the things that was brought up as a potential problem during the stay-at-home order was an increase in sexual assaults. It could be someone you're actually quarantined with, confined with, a family member on a family member. It happens, and it's hard to report. Some people don't want to report that stuff, but there is help and there are ways to report it. Ryan, Lieutenant Maltese, do you want to talk about some sexual assault stuff?
Sure. Some of this echoes the resources that were provided by Lieutenant Linus. Obviously, we're living through some unprecedented times with the COVID-19. Survivors of or victims of sexual assault are typically vulnerable during these times, spending more time isolated in a potentially unsafe environment. We want to make sure that our viewers and our residents know that there are resources available. We have some posted right on our website, lakevillepd.org. Echoing Lieutenant Linus, JaneDoe.org. That's another one for temporary housing and assistance. The SafeLink number would also be sufficient for victims of sexual assault, which is again 877-785-2020. And if you have any type of immediate emergency, if you're being abused sexually, whether it be domestic violence, always call us. 911, we're always here, and we will certainly come out regardless of the time, the pandemic. We're always here for our residents.
Thank you. I just want to add something on a sexual assault. We have sexual assault investigators here. If you are a victim of sexual assault, it's always best to go to the hospital and have what's called a sexual assault evidence kit completed that can collect evidence. You can remain anonymous when this happens to see if any evidence was found. It can be done up to a week after the sexual assault actually happened. We recommend that you don't shower. You take the clothes that you were wearing with you, and you go to the hospital, and that's how you kind of start the process. And you call us. We'd like to be what's called the first reporter. If you want to, call us, or if you tell somebody about it, don't tell multiple people. Call us. We'd like to preserve witnesses. We'd like to preserve your statements and collect evidence. So we'd like to do it in a timely manner, but time necessarily doesn't control the situation. If you were sexually assaulted a month, a year, more than that, come and talk to us, and we can get you some help. After that, we have Project Outreach. There was some concerns that what's going to happen with all the people who are opioid dependent during this coronavirus times. Are they still going to use? Some people thought it would be an influx in addiction, and the rates would go high. Lieutenant Linus has some updates on that.
Okay, so Plymouth County Outreach is a multifaceted collaboration of 27 municipal police departments in Plymouth County, as well as Bridgewater State University. We work together to make treatment more accessible for those struggling from a substance use disorder in their families. So how it works is after somebody has overdosed in your town, within Plymouth County, we attempt to contact that person within 24 to 48 hours of that overdose by doing physical home visits. So that has not been put aside since COVID-19 started. We are still doing it, but we're just not doing the home visits. The recovery coaches that goes, so what would happen was I would go with a recovery coach to that person's home in plain clothes. We take the uniform out of it, so it doesn't, it's not intimidating to them, thinking that they're in trouble or anything like that. And all we do is offer them help. That's it. There's no criminality to it at all. They're not being charged with anything. And we try to take that away so they do kind of get the help that they need. So this started somewhere around 2016, 2017. Like I said, it's 27 police departments, Bridgewater State University, and we partner with many different outreach recovery places like Gosnold and all over the state. I mean, there's too many to list. But so, like I said, we do the recovery. I mean, we do the visits and attempt to get them help. So since this started, we have made 575 home visits since 2017 with a police officer and a recovery coach. Of those 575 home visits, 395 individuals have accepted help from the outreach team. And so that's very encouraging. They try not to, of course they love success stories. Those are very difficult to track, as far as, unless they come back to us and tell us, hey, you helped me out. Another component of the Plymouth County outreach too is we do what they call at-risk referrals. So if a family member has someone that is that they believe is at risk for substance use, we will put them in at risk. That doesn't necessarily have to be an overdose, but we try to head it off before that happens. So we will do an at-risk referral, and then we will go out and visit that person and try to get them help. So that has increased drastically over the years. So That's another thing. So what we try to do is there is a database, and we do track a lot. Fortunately, Lakeville, I mean, there hasn't been a huge change in the numbers as far as overdoses this year. So from we only had in Lakeville, we only had 2 from March 1st to June 11th. And this year we've only had 1 from March 1st. We have not had a fatal, those are non-fatal overdoses. The last fatal overdose that we had here in Lakeville, that was in July of 2019. Now that doesn't count Lakeville residents that overdose out of Lakeville. We do get notified through Plymouth County Outreach that, hey, you know, Johnny Jones overdosed in Brockton. He lives at, 123 Main Street, whatever. And we would go out and do that visit. And that's kind of how it works. And it works the opposite way. If someone from out of Lakeville overdoses in Lakeville, we contact that person and they do that. So there hasn't been a huge change in, with any substance use disorder. It's not going to change because there's a pandemic. We did see a huge spike in overdose deaths right around right at the end of April. We had 11 fatals in a 10-day period in Plymouth County alone. So those are very difficult to attribute. Usually before fentanyl came around, if we had a spike like that in heroin, we would think it's a bad batch of heroin. Now it's kind of like, now that it's mostly fentanyl, it's just, we're just assuming that it's a bad, not a bad batch, but just they took too much, or as EMS can say, I mean, they're just not properly. Sometimes people come out of rehab and they think they can take the same amount as when they went into rehab, and that always hurts too. So there was a report that came out today that overdoses were down in the state. I'm just going to look that up quickly right now. So in the first 3 months of this is statewide. In the first 3 months of 2020, there were 467 confirmed and estimated opioid-related overdose deaths, and an estimated 28 fewer deaths, or a 5.7% decline compared to the first 3 months of 2019. So I kind of attribute that more to, I'm sure I'm sure the users are down, but I kind of attribute that to, one, there's easy access to Narcan now. You can get Narcan pretty much anywhere through PCO, CVS, you can get it. But I also attribute that to police and EMS for mostly our quick response and us administering Narcan quickly and bringing these people out of, their overdose. So that's pretty much for overdoses during the COVID, but there's plenty of resources out there. So PlymouthCountyOutreach.org. There's plenty of resources on there. They have every Tuesday, and if you go on the PCO Plymouth County Outreach website, they're having meetings, Zoom meetings now, because they had to stop. They were doing drop-in centers. A lot of the churches in Plymouth County were allowing, they would have recovery coaches. They can't do those anymore. So they started having Zoom meetings. And those are on the website. They're Tuesdays at noon and Thursday at 2:00. If anybody that wants to join, and the meeting ID numbers are on there. So if anybody that wants to join can join. So that's all I have on the Plymouth County Outreach.
Thank you, Lieutenant. And our last subject that we're going to talk about is what we are seeing an increase of. And I think this can be attributed to everybody staying at home, which is scams, fraud, internet fraud, identity theft. It's out of control. I think when you have people under a stay-at-home order and they're bored and they want to get on the computer, it's gonna result into what we're seeing right now, which is scams and crime. And with that, Lieutenant Maltese is going to update us on that.
Just to add to Lieutenant Linus's PCO and overdoses, we also on our website, lakevillepd.org, have a whole section on substance abuse information. If you click on that link, it'll bring you to local links, PCO, and what have you. So again, our website's pretty up to date. It has a slew of information and resources to visit for our residents and visitors. Getting into the scams, they're ever evolving. One of the scams that seems to be the most prevalent right now across the state, not just with the town of Lakeville, is an unemployment scam. And what it is criminal enterprises have gotten in possession with people's personal data, whether it be through a data breach or whatnot. That is to be determined. They're trying to figure out what the pattern is, if people use a certain store, what have you. But nevertheless, the information is floating out there. And what's happening is folks are getting mail from the Department of Unemployment Assistance that their claims have been either approved or denied. These people have not applied for any assistance. So what's happening is being fraudulently filed on their behalf by scammers to try to obtain monies from these. Again, on our website, we do have links, step-by-step instructions with clickable links that'll bring you right to the steps, but I will go over them briefly for this purpose if you don't have online access. The first thing you want to do if you are employed, you want to notify your employer, whether it be resources, whoever does your payroll and filings. You want to file a online unemployment fraud report form, or if you don't have access, you can contact the unemployment office at 877-626-6800. Again, if you go to our website, the form link, online fillable form link is on the website. Third thing you're going to want to do is report identity theft with the Federal Trade Commission. What they'll do is they will help alerts and flags on your credit, as well as give you resources and assistance to come up with a recovery plan if this fraud has impacted you. You're going to want to place a fraud alert on your credit file. You can do that through the credit reporting agencies, the bureaus. I recommend, not just for victims of frauds or scams, but periodically take part and take advantage of getting your free annual credit report. Do that online through our link. It's a recommended site through the Federal Trade Commission, and make sure there's no fraudulent activity or accounts that you didn't know about being opened in your name. It's a lot easier to come out of this if you get it ahead of time, or immediately after it happened. The longer it goes and the more accounts that are open, the harder it is to come out. If you have any questions, you can certainly call us here at the police station, 508-947-4422. If you want to file a report, I know some agencies or employers do require a police report to be filed. You can certainly do that too. But again, a lot of the resources and information is on our website, but you're always welcome to call here for further assistance.
Thank you, Lieutenant. And we have wrapped up our updates from the police department. So I'd like to turn it over to Lieutenant Ryan Sylvia of the Lakeville Fire Department.
All right, thanks, Chief. Hey, everybody. I'm Ryan Sylvia. I'm a full-time lieutenant and paramedic with the Lakeville Fire Department. I'm joined today by firefighter Aiden O'Brien. who is a call firefighter EMT with the LFD. We're just going to go through just a quick overview of the Lakeville Fire Department's operations up until this point in 2020. So obviously 2020 has been an interesting year for everybody. It's been a challenging year, I think, for everybody. And that goes for the fire department too. We've gone through a lot of challenges with everything that's been going on so far this year, but we've also had a lot of good things that have occurred too. So kind of starting off in 2020, I think the goal of the fire department really was to just improve and expand on our capabilities and our service that we offer to the community. And the department's undergone like a really big transition over the last couple of years. We have a lot of new firefighters, a lot of very young firefighters, a lot of very well-educated firefighters. We've improved our capabilities a lot over the last year or so as far as our equipment. We've gotten some new apparatus, command vehicles, extrication tools and equipment and hose, and to really kind of improve our abilities. And I think that in 2020, we stepped forward trying to improve our training and education capabilities a little bit. I'm the training officer for the department, and I can tell you that we're doing more training now than we ever have at any time, I think, in the history of the department, or at least since I've been around. We do at least 2 department-wide drills a month now. We just recently implemented a in-service training program where our company officers have been empowered to kind of create their own lesson plans based on a monthly topic to train their personnel. And we've also expanded the capabilities for our EMTs and paramedics in conjunction with our medical control at Morton Hospital Medical Center as well. At the beginning of the year, we trained our EMT basic personnel in the use of CPAP and also nebulizer treatments for patients that have respiratory distress. That's an enhancement to the EMT basics capabilities beyond what they are normally allowed to do. That was done in conjunction with our medical control. We've also expanded some capabilities to the paramedics as well. We added a new drug called ketamine to the trucks. That came online in April. And that medication does a couple of things for us. It's a non-narcotic pain medication. So we can utilize that in place of a narcotic pain med such as fentanyl. And it's a very effective pain medication, and it's also a very good sedative medication as well, which kind of ties into what the Chief Perkins was talking about a little bit as far as trying to de-escalate situations sometimes. And you may have a patient that is combative due to a medical problem or a psychiatric issue, and in the past where we would have to physically restrain that person for our own safety, now we have a very good tool that we can use actually to chemically sedate them, which is a lot safer both for the patient and for the providers as well. And that's something that we didn't have in the past. We did have some medications that we could use for that, but they had some pretty difficult side effects that we had to be concerned about, and it was kind of not always appropriate to give those meds. But with ketamine, it's a very safe medication, and that we can utilize that both for sedation for people who are being violent, and also in small doses for pain management as well. So that was also added in conjunction with our medical control as well. So obviously, probably the biggest thing that's affected the fire department in the recent months is, of course, the COVID-19 pandemic. We've been on the front lines of that situation, along with basically every fire department in the Commonwealth and the country and probably the world as well. So I think for most people, when they start thinking about the COVID-19 pandemic, it really started to affect the general public, at least in this state, probably in March when the state of emergency was declared, and you started seeing the shutdowns and quarantines and lockdowns. But for us, we really started to plan this out back in January when the first cases started to hit the U.S. In January, we made a big order of N95 respirators. I think the department leadership saw that there was a potential that the supply chain could be delayed or interrupted once we started to really get into the height of the pandemic. So we made a preemptive order of necessary protective equipment supplies. In February, we started ordering isolation kits and eye protection for our members. And it was really important that we started to stockpile that protective equipment, because this was a big change for us as far as our utilization of protective equipment. prior to COVID-19, universal precautions for EMS was basically you wore rubber gloves on every patient contact, because our main concern was, bloodborne pathogen type thing. So like you worry about diseases that can be transmitted by blood, such as HIV or hepatitis. That was kind of always like the primary concern. Respiratory illnesses weren't really a huge deal in this country. So we very rarely had to utilize respirator equipment such as N95 masks in general practice. I've been in the fire service for 13 years, so I've been on the ambulance for the majority of that time. And prior to this situation, I wore an N95 mask once in my career. And it was when I was taking care of a tuberculosis patient, which was up until recently really kind of one of the few respiratory illnesses that we were really worried about in EMS. If we had somebody that had flu-like symptoms, generally we would put a surgical mask on the patient just to kind of contain any airborne droplets, and then that was kind of it. Whether that was the best thing to do, that's a different story, but that's kind of how things were handled in EMS up until this point. And then COVID kind of changed everything, because the transmissibility of that disease is so high that we really needed to liberalize our protective equipment policies and start wearing more of this stuff on a regular basis, basically anytime that we came across somebody that could have COVID symptoms or flu-like symptoms. So getting ahead of that was a really big deal for the fire department, and it really paid off once that state of emergency was declared, and you started seeing that big rush of all these agencies starting to try to purchase that PPE, and they started applying for aid from the Emergency Management Agency and FEMA, and of course those supplies never come right away. There's usually a gap from when you request that to when they actually are able to come, and so by us getting that equipment in early, it sort of bridged the gap until that supply chain was able to catch up. And I can tell you that we're probably only one of a handful of departments in the state that can honestly say that we never had issues with our protective equipment supply throughout even the height of the crisis, which I think is a credit to the fire department and a credit to the leadership for sure for getting us prepared for that. So specifically, what changes when it comes to protective equipment for us now? So right now, the department policy is anytime that we go out on a call, we have to have a minimum of a face shield and eye protection on. Okay, so not a respirator necessarily, but just some type of a face covering and eye protection. And the idea behind that is it protects us from anybody that may have a asymptomatic case of COVID-19. Right? And there's some debate now back and forth about how much asymptomatic patients actually spread the disease, but we always go out of an abundance of caution. So when we go out and you see us out and about, we're always going to be wearing a surgical mask or a face mask and eye protection. It doesn't mean that we think that you have something. It just means that it's just standard precautions that we take now for everything. If we go to a patient that is a suspected COVID-19 patient, which is a large list of symptoms that can range from respiratory distress to fever to flu-like symptoms to GI symptoms like nausea and vomiting. At that point, we then kick our enhanced protective equipment into place, which means we're going to have our N95 respirators on, we're going to have our eye protection, we're going to be wearing either a medical grade gown or a Tyvek suit to provide splash protection if somebody sneezes or whatever. And that's going to be kind of our full PPE ensemble. That's actually above and beyond the CDC recommended guidelines. CDC recommends that you wear a gown if you think there's going to be some type of airborne issue. But we found that the medical grade gowns weren't working that great in EMS because they're kind of fragile for a lot of like the active work that you're doing on the ambulance. So we found that the Tyvek suits actually work better. We were able to get a really good supply of those. And they've done a pretty good job for us. But we're going to have all that stuff on for anybody that we even suspect could potentially be a COVID-19 patient, just out of an abundance of caution. When we arrive on scene now, the first thing that we do is we check the patient's temperature, which again is a change in procedure for us. Normally, we wouldn't check a temp unless it was indicated. Now we do it for everybody, just on the off chance that you may have somebody that has a fever and doesn't know it. And then the person also gets a surgical mask placed on them, which is going to be required both to protect us in the confines of the ambulance, and then also it's required when we bring them into the hospital now as well. So just a lot of just standard precautions that we're taking now that are enhanced from the pre-COVID-19 world. And I think that you're going to see a lot of those precautions stay in place for quite some time. And I think that you're really going to see a permanent change in how EMS looks at protective equipment. I think that at some point, as this starts to die down a little bit, and maybe we start getting some more effective treatments and maybe even a vaccine for COVID, you're not going to be seeing the full, Tyvek Sue on all these calls. But I think that you're going to see the respirators and the masks and the eye protection become more of a standard part of EMS care going forward. And you can make the argument that maybe we should have been doing that all along, but the COVID-19 situation definitely pushed that to the forefront to get us some improvements in that area. So that's kind of where we stand as far as the protective equipment goes. And like I said, the department did a great job as far as maintaining PPE for all its personnel, and we still are doing so great to this day as far as that goes. When it comes to protocols, COVID-19 really kicked into gear some of the changes that were, I think, going to happen anyway when it comes to the changes in EMS protocols. There was a lot of discussion recently in regard to community paramedicine in Massachusetts, which basically means that your typical paramedic response is as an emergency medical provider. You go, you treat the patient at the scene, you provide transport and route to the hospital, and you bring that patient to the emergency room. That's kind of like the limitation of our service, I guess you could say, to the patients and the communities. Well, the thing of it is that a lot of the patients we deal with, taking them to the emergency room every single time they have a problem may not necessarily be the most effective treatment for that person. They may need something a little bit more long-term. They may need more long-term follow-up, maybe better access to primary care. And we had previously a very limited capability to do that. And with this community paramedicine program that is starting to take foot in Massachusetts, it enhances the capabilities of paramedics to do more home type care, almost more type like home nurse type care. And you can go in and you can evaluate a patient and say, okay, maybe going to the emergency room all the time isn't solving the long-term issue this person has. Is there other things that we can do? Can we set them up with home care? Can we do telemedicine? Can we do maybe follow up with the Council on Aging to get them some more services? Can we maybe look at their medications and make sure that they're getting their medication dosages adjusted, or the medications that they're on adjusted? These are things that you can do at the community paramedic level. And the implementation of this in Massachusetts has been very slow. But we all think we knew it was coming. And I would say that within the next few years, if you would talk to me in January, you would start seeing some slow rolling out of some of the stuff. But then with the COVID pandemic and the limitations that came with that, as far as people being locked down and not being able to get to their normal healthcare settings, the normal primary care and whatnot, you started to see an acceleration of some of those, the implementation of some of those things. And specific to COVID, the state actually put out a treatment protocol that allowed for non-transport of suspected COVID patients that were stable. So previously, if you were to call 911 and an ambulance were to be dispatched to your house, I, as a paramedic, was legally obligated to say, you really need to go to the ER to get checked out, right? There really wasn't any like in between there. If you call 911, I really recommend that you go to the ER, and if you don't want to go to the ER, you're basically acting against medical advice, so we have to get refused on it, right? Sometimes that's not always the most appropriate thing, and especially at the height of the COVID pandemic, there was a lot of concern that we would be bringing these patients that maybe they had the virus, but they weren't really in an emergent situation. But then you take them into this hospital where you expose them to people who are more vulnerable, and that virus spreads that way, and then maybe affects people that are that are more susceptible to having severe symptoms. So they released a protocol in late March, I believe, that basically is a flow chart where somebody calls 911 that is experiencing, COVID or flu-like symptoms, but they're mild. So then you go and you look at that chart and you say, okay, the patient's learn-oriented, they can make their own decisions. Are they between 18 to 55 years of age? Do they have mild viral symptoms like a cough, sore throat maybe, but their vital signs are stable and they're not having any respiratory distress or underlying complications? What we can do is we can call medical control at the hospital. We can say, hey, look, this person, may be a COVID patient, maybe they have some mild symptoms, but they're not really at the point where they need to go to the emergency room. What do you think? And then between the consult between us and the medical control doctor and the patient, maybe we can set up more of an alternative, care plan for them as far as maybe following up with their primary care, or maybe getting them an appointment with a telemedicine conference to follow up, and maybe getting them some antiviral treatment or just something like that is going to be better than taking them into the emergency room and then potentially exposing other people to what they have when it's not necessary. So that protocol was put into place. We haven't had to use it in Lakeville yet because I think most of the people that had these symptoms that were mild just didn't call 911 because they didn't think it was necessary and they didn't want to go to the hospital, which was a good thing. But it was put in place, and this protocol right now is specifically for COVID. But when you look at it, you can kind of see the starting of that change in EMS to where these protocols may start to open up for more things going forward. And that's something that I didn't think was going to happen probably until a few years down the road, but because of the situation, it kind of accelerated things. The other protocol that we saw put into place in April, kind of at the height of this thing, was the protocol 6.11, which is the termination of resuscitation in the field. This is a protocol that's been on the books for a few years now, but it wasn't widely adopted in Massachusetts. And basically what it does is, if we respond out to a cardiac arrest patient and we're doing CPR on this person, instead of immediately getting ready to transport this person to the emergency room like we always would have done, we're going to work this patient to our full protocol for 20 minutes on scene. Okay, and our capabilities as paramedics now are so advanced that working a patient like this on scene with what we can do and then working them in the emergency room is exactly the same. There's no difference between what I would do and what a doctor at the hospital would do in that first 20-minute period. So you work the person for 20 minutes. If you don't have any positive changes to their condition within 20 minutes, medical guidelines through the American Heart Association and basically every other relevant organization tell you this person really doesn't have any chance at all of survival. So at that point, what we can do is we can contact medical control and we can talk to the physician at the hospital and say, look, this is what we've got. We've worked this patient for 20 minutes. We have no positive change. They're still flatline on the monitor. We've given them all these rounds of drugs and we're still at the same point. Can we get orders to terminate this resuscitation instead of transporting them to the hospital? We don't have to utilize that protocol, but it gives us the option to make that call. And again, that's a big change for us. I mean, normally we would always just, our goal in the past was always just get in the hospital, get in the hospital, get in the hospital. Now we're kind of starting to think a little bit more nuanced about what the benefit is to doing that. And again, I think that you are probably going to see this protocol come out anyways within the next couple of years for us. But the COVID situation, I think, really accelerated it forward because at the height of this, there was really a concern that, a lot of these people were going to be dying at home and you were going to be doing, CPR and all these aerosolizing procedures where you start putting viral particles up into the air when you're trying to breathe for them through the bag valve and intubation, that kind of thing. And you were going to be spreading this stuff, bringing them to the hospital. So I think that there was a concern that, well, if we implement this protocol, we can maybe work this person on scene, and if there's no benefit to transporting them, then we can call for orders to terminate on scene, and that will prevent the hospitals from being overwhelmed by these cardiac arrest patients coming in that may be COVID positive. And, I think that we saw that ultimately that like nightmare scenario as far as hospitals didn't really happen, which was a great thing. But the protocol was still in place. And this is not specific just to COVID patients. This is for anybody. And we have utilized this actually a couple of times now since it's been implemented. And again, it's just another kind of step towards giving us more discretion as to how we treat and transport patients going forward. And like I said, I think that this whole situation just kind of compressed that timeline down quite a bit. So that was kind of like the big changes that occurred for us as far as protocols go. As a department, it's definitely been kind of a challenge over the last couple of months because we haven't been able to kind of go out and interact with the public as much as we have in the past, which is always, a really big thing for us to be able to do. The station's obviously been on lockdown since the state of emergency was declared in March. We suspended like our normal like smoke detector inspections for selling homes and sort of things. So we've kind of been in a little bit of a lockdown. We've tried to go out as much as we can into the general public and support folks as far as maybe doing some birthday drive-bys. We've done quite a few of those recently, just trying to get out to the community. But I think that you're going to start to see us as the state starts to open up. You're going to start to see us kind of get back a little bit more into normal as far as that goes. I know we're planning on starting the smoke detector inspections up again on the 15th. And I'm sure the building probably won't be on lockdown for too much longer. But we're kind of getting a little bit back into more of our normal operations now. And the Chief Perkins kind of touched on it a little bit in his part, but we actually did, in the height of this, we saw a big decline in our run volume because I think people just were kind of buttoning up and they didn't want to go out and go to the hospital and expose themselves. And so we did see a drop in calls, but I think the downside to that was you had people that had legitimate health issues that were afraid to go out because they didn't want to get exposed to the virus, and they kind of let things linger for a little while, which then made things worse for them when they finally got to the point where they had to call 911. So we didn't really want to see that, but I think that was kind of like an unintended consequence of all the lockdowns and kind of the fears and the concerns about the spread of COVID. I can tell you now that we've basically kind of gotten past that. We're pretty much back to our normal call volume right now. It seems like things are starting to normalize a little bit on that front. For sure, and we're kind of getting back into like our normal operations. Even in the department now, we're starting to kind of transition back into kind of like a little bit more of a normal mode of operation. Still with precautions. We're still screening all of our members for symptoms. If you're on duty, you have to screen twice a day. Even if you're off duty, you have to take a temperature and screen for symptoms at least once a day. We're continuing to do that as well. But that is really a small sacrifice to make, because by doing that, it's allowed us to be a little bit more open with some of the stuff that we were doing as far as like continuing training and stuff. We did a lot of like stuff by Zoom when this first started happening, and then we were able to kind of open things up a little bit. Some departments shut down their training divisions altogether because of the need for social distancing, but because of some of the more conservative protocols we put in place as far as screening our members, we were able to kind of continue doing that sort of thing. We're going to continue to do that probably for the foreseeable future, because the pandemic's starting to wane a little bit now. The numbers are going down. We're moving in a positive direction, but it's not over yet, and we're probably still going to be living with this for quite some time. So that's kind of where we're at from the fire department perspective as far as our COVID response moving forward. And like I said, we're starting to transition to a little bit more of a normal operation right now, and I think that you're going to start to see us out and about a little bit more in the near future here. So, Aiden, do you have anything to add as far as your perspective on the fire department, where we're moving forward, and kind of our responses up until this point?
I know we've been very progressive and proactive when it comes to changing how we used to practice before all this COVID crisis. I know, I can speak for the rest of the call department and a lot of our active members. We say we definitely feel safe working. The protection level has been there. I credit that to our officers and our brass being proactive with getting us equipment. So that's been a plus side to working in Lakeville. We look forward to interacting with the public again and further developing relations and educating the public on what we're doing, And that's about all I have to say.
Awesome. Chief, you got anything?
So to tie to what Chief Perkins said, communicating trust and trust being so important to our departments. One of the key things that we do is our public relations and our, whether it's social media or open houses and getting out in the public. Our ability to practice and execute our job, it relies on the public having enough faith in us to let us into their homes and trusting us with our loved ones. And as you guys listen to some of the things that Ryan was discussing, it's, these recent changes are a big departure from how we do business normally. We, stopping CPR on somebody in somebody's house, and what comes next? We're walking away from a deceased person. That's a really emotional situation that we have to deal with, and it's really, it sounds almost nuts and bolts for us to talk about it here, but it requires us to coach the family and almost provide a narrative about the care that we're delivering and talking the family through the resuscitation process. And it's, we know that the science tells us that when we don't try to move a patient and we do CPR on them right where we find them, that the resuscitation rates go up about 20%. So we're doing the best thing for the member, for the family, for that member of that family. And we know that transporting patients is extremely risky to the providers. There's a lot of vehicle accidents and things like that. And if we are transporting somebody that has a unlikely outcome or a bad outcome, it's risk benefit. It's basically a risk benefit analysis that we're doing, and we're doing the best or the most good for the public by following these new changes. And without this level of trust, it can be a sticky situation. So I just want to thank the public for giving us that trust and putting their faith in us to allow us to come into the houses and provide patient care and whatever, not just patient care, but all the services that the Lakeville Fire Department provides. And we hope to maintain our worthiness of that trust. And from an outsider coming in, and I am a relatively new employee to the town of Lakeville, and I have 30 years in the fire service. I've worked with multiple law enforcement agencies and multiple fire departments, and I can promise you that there's something special going on in this town. It's not a job, it's a calling. The people care about the town, they care about the service that they provide, and we invite you to get to know the fire department, get to know the police department, because there's really nothing to hide. The more you see, the more you'll appreciate our service, the more trust you'll have in us. I just, I extend my compliments to the officers about the department that I took over. I extend my compliments to Chief Perkins about his department. We're a small town in transition, and that small town, there's plenty of access to the residents, and the residents have plenty of access to us, and there is truly something special going on here, and it's my job as the fire chief and Chief Perkins' job as the police chief is to keep on going and maintaining the trust. So anyway, that's just what I wanted to add to it. I know there's more to this discussion, so we're gonna move into like a kind of a mental health roundtable, and mental health issues. It accounts for a large portion of our responses for both police and fire, and Chief Perkins will tell you, and I can tell you that dealing with mentally ill or somebody who's going through a temporary crisis is extremely dangerous for all participants. It's a very unstable situation and very very fluid, and it's something that we both EMTs and police officers we do a lot of training on, and we do a lot of continuing education on. We go to classes, and we always try to improve our ability to respond to these situations. So there's no secret that this has been a stressful 2020 hasn't been kind to us. It's been a very stressful period of time that we're dealing with, and
I'm gonna throw it back to Ryan, and maybe he can talk about some of the experiences. But I can tell you statistically, we're not just specific to this crisis, but in the past few years, mental illness, or what we call the psych calls or behavioral emergencies, have increased and become one of our leading reasons for sending the ambulance out the door.
I can definitely back that up just from experience of working on shift. That it's definitely gone. We're going in the wrong direction as far as our response to mental health and psychiatric emergencies. It definitely seem to be making up more and more of a higher percentage of the calls that we go to. That's not a good thing. We want people to have healthy minds. Because if you have a healthy mind, you're much less susceptible to some of the physical symptoms of physical illnesses that come with that as well. But it's difficult in this day and age, especially this year. It's been tough on a lot of people. We've had a lot of issues with, you're basically going against human nature when you're telling everybody to lock down and stay in your homes and don't interact with other people. We're social creatures by nature, and we don't want to do that, and it affects our mindset in a negative way when we do that. And then of course you have the other consequences of these quarantines and lockdowns too, where you have businesses shutting down, you have people losing their jobs. Hopefully most of that was temporary, but when you create an economic downturn such as what we did when we did these lockdowns, there's always a potential that some of those jobs might not come back, and that sends people spiraling down into bad places in a lot of cases. And it's really unfortunate that I've seen some people that I know struggled with mental issues for a while, and they were starting to turn around, and then this whole thing happened, and you start getting the negative consequences of quarantine and job losses and whatever, and then those symptoms surface again, and now we're starting to see people that had improved themselves to the point that they were okay, and then we kind of send them back down the tubes again with all the stuff that is going on around us. That's really unfortunate. But when it comes to mental health, I mean, just in general, when you're dealing with the crisis that we're in, it's really important that you take, I think, some time to analyze yourself a little bit, realize kind of where you're at and what you need to do, right? Don't just constantly go 100 miles an hour. Every once in a while, you have to take a second to just step back, breathe, and kind of figure out where you are. Try to take some breaks from social media and the news, because we're just getting bombarded with so much stuff right now, and we just move from one crisis to another. We went from coronavirus 24/7, live death counts every second of every day on every media outlet, to now we're dealing with these horrible race riots and all these things that the police chief had talked about to begin with, and that's being bombarded on us in the news 24/7, and it's just a lot of chaos and a lot of negativity, and even if you're not directly involved in what's going on, it affects you just by constantly being in that environment. So try to take a break every once in a while from that stuff, and it's tough because we're so connected now through social media and everything else, but try to take a break every once in a while. Keep making sure that you keep good sleep habits, exercise. That's always a really good thing for mental health. Don't become inactive, which again, up until recently with all the lockdowns, it got tough sometimes. And make sure that you reach out to your friends and family, stay connected, even if you have to do it remotely. And don't be afraid to reach out and seek help if you're you're overwhelmed or if you feel unsafe in any way. There's resources that that are out there for you, and even for us. I mean, if you get to the point where it becomes a problem where you have to call 911, hey, we'll come there, and part of our training as EMTs and paramedics has to do with mental health too, and being able to take care of people in that manner. And when we transport you to the ER, you're going to have resources there that you can get in touch with, and we can help you out that way as well. So don't be afraid to reach out at that point. And this affects everybody, and it affects probably first responders maybe even more than anyone else, because we're so involved in it all the time, and we can't necessarily shut it off because it's our job. I know for me, I'm definitely looking forward to being able to get out and take some time off after all this is over.
No vacation. No leave. No vacation. Sorry.
Yeah. Well, but seriously though, that's actually part of what we had to deal with as first responders, though, is that we did have to cancel leave for a little while we were in the middle of this, because part of the problem when you have such a symptomatic sorry, not this is like a virus that spreads so much is, we have a department of 12 firefighters, right? We added 2 temporary positions because of the pandemic, so we have 14 people that we're dealing with. If you get one person that gets this virus that is so easily transmitted, and then they transmit that amongst different groups of firefighters, you lose your whole fire department, right? So one of the things that we had to do is we had to actually lock down our groups. So we added 2 temporary firefighters to give us 3 firefighters on duty 24 hours a day. And basically we canceled all of our leave and said, okay, the 3 people that are together on these groups are going to stay on these groups, until further notice. And we've gotten to the point now where we're able to start maybe relaxing that like a little bit, but still we went for months on end where it's still, getting to the point where we have to try to keep ourselves, separated and isolated from each other as much as we can, because we don't want to, have one person that gets sick and then contaminates other people and then potentially takes us out of the game for good. So, that always weighs on you too, because now you're like, okay, I can't take a time off from work. I really can't. I have to be careful with going out and interacting with people because I don't want to get myself sick and then maybe bring that back to work when I don't even know that I have the illness, and it adds to mental stress.
One of the things that it seems like a million years ago that this all started, and some of the initial responses that we had when we're going into, a confirmed case or somebody that we knew had COVID-19, and it was still unclear like how contagious it was, and you saw veteran responders very tense and very concerned, and very nervous. I mean, we prefer to face dangers that we can see versus unseen dangers. So having to be in close proximity to somebody that you knew was infected was unnerving. And so, like for me, and I'll throw it over to Chief Perkins. For me, it's about routine. Like I relieve stress by going to the gym in the morning, working out, mostly, maybe talking a little bit with other people at the gym, socializing, but working out a little bit. And that's my stress reliever, having a little bit of routine and taking care of myself. And all of a sudden that avenue was cut off. And so like, it's like people thrive on routine. And I think people do better when they're active. And I'm sure like it's similar for the police officers, because we worked with police officers on these calls as well. And, we saw the stress in their eyes too, when they have to be exposed to this stuff. Or when we, in some situations where we discovered it was a COVID-19 call after we're in close proximity to an individual. So it was stressful situations. And I'll ask Chief Perkins. I mean, for me, it was that, the lack of routine or the change in routine caused me stress, and I can't wait to get back to that exercise routine, and that's how I deal with stress. And I don't know about you.
Yeah, so I'm a big promoter of find a hobby, do something, and this time if your hobby like going to the gym was canceled, find another one. Get out and do some activity, to go hiking or do something. So it's important to have that stress relief and activity. Phone ringing. Have that activity where you can get through this. Us as employees, we also have the assistance to the town with the employee assistance program, where we can reach out and get services that way. And that's us. And I think we're going to see, what are going to be the long-term effects on mental health, not just us in public safety, but the citizens of Lakeville. Is there going to be an increase in alcoholism? Is there going to be an increase in drug use? Do we have some, mental health problems that are not going to go away when the coronavirus goes away? And we're looking at solutions. Right now, Plymouth County Outreach has a mental health program, and they're modeling it the same way for the opioid abuse, where if we identify someone in the community, we can get them services. The same thing that it's a new program we're going to get on board soon, where if someone is identified in town that could benefit from mental health assistance, then we can do that. And Lieutenant Linus, if you want to talk about that and what that program offers, we can go from there.
Yeah. So the program is called Hub. It was started. it's sporadic kind of around the country. It started up in here in Massachusetts not too long ago. So again, it's just a collaboration of mental health counselors, police departments, and all outreach workers, and then they go out and they try to get this person help, but it also gets the family help also. So it's everybody that's included in that. It works with all mental health professionals. They instead, so with PCO, we go out with a recovery coach. This here, they go out to this place with a mental health worker. And then it's kind of working on the same premise. And they even bring in if there's child advocates, so they help children who have parents with mental illness. They have if they have people that will help get the family assistance with government assistance with food and stuff like that. So it's just more of a family oriented, get a whole family the help that they need. So their meetings, they do have meetings, and we bring, so if we have someone in town, and I'm sure we all know who we have in town, we can bring that forward to them, and then it's reviewed, and then they go from there, whether they're going to take on the case or not. And 9 times out of 10, they do. I mean, it's called Hub. So
one of the things that kind of strikes me as I'm listening to you and to the police chief and to Ryan, Lieutenant Sylvia, is the ever expanding burden on first responders, the services where that need to be provided, and there's really not an infrastructure to deliver those services. It kind of falls on our shoulders, and in the context of all the media and the push to defund certain agencies and things like that, it's it's striking to me like the increasing mission, or the widening of the mission of all first responder agencies, and we're kind of like the stopgap. We're like the Swiss Army knife of government. When you're not sure who to give a job, it almost always falls on either the fire department or the police. And it's just an observation. Whenever there's a crisis.
Yeah, and the public really does not see that. I mean, take 2 weeks ago when we had 2 mental health calls for emotionally disturbed persons within the same hour. One was a multi-jurisdictional. We were in Middleborough, and then we had the other guy behind Joe's Gas at the same time. The public doesn't see that we, that we're going from, some days we go from call to call, and eventually it took one of our officers probably on the phone with this one kid 1 hour to talk him out of the woods. So yeah, it's just stuff that they don't see, and frankly, I'm not sure they want to see it. If it's, if they don't see it, it probably doesn't exist.
Part of our job is what the public expects is that we deal with this if they don't have to. That's part of our burden too, and that. But the chief's definitely right that it falls. We have a lot more stuff that's kind of falling onto first responder agencies right now, and our mission is always expanding. And I think that adds to the value of both the fire and police services when you are able to offer so many services to the community. Right.
Regardless of the conditions, we're always going to go. We're always going to be there. It doesn't matter what the conditions are. We're going to go. We don't get to pick and choose. So,
and that's something that the mindset is. I guess the professionalism is what they really need to understand is that there's so much preparation that's involved and so much training that's involved to do all the jobs that we've described today and talked today, and there's so much continuing education involved, and it's important that they invest and they become familiar with our operations. That I had a professor, he called it proximity. It was basically that the citizenry trusts the government that's most proximate to them, that's close to them, and they tend to mistrust like government that's far away from you. And I think we see that. I think we see like all the negativity about the federal government and the governor and this police agency that's, you know, on the other side of our nation. And I think if we ask those same people how they feel about the local agencies, I think they feel pretty good about it. And I think that's a tribute to the work of our people and, you know, our outreach efforts and things like that. It's I don't know if any of that made sense, but it's, you know, it made sense in my head. What's that?
I followed you. It made sense.
Okay, good. Are we, we're going on about an hour and a half. I think we could probably do another hour and a half. I'm surprised that I thought we'd be struggling to fill time, but do we want to keep on talking, or do you think the people of Lakeville have tuned out by now?
I think that we've filled up a pretty good block of Lake Cam's time now with what we've got. We can continue on with these topics for hours at a time. There's plenty of content to talk about for sure, but I think that we've gotten the message out to the people, and you know, the biggest thing is for folks to know that your fire and police departments are very, very strong in this town, and we're here to help you no matter the situation that you're in. We're always there for you.
Maybe we should have the cameras follow us around on our personal time, you know? No, that's a terrible idea. What am I talking about?
Yeah, too much is said.
Does anybody else have anything to add wrapping up, or Aiden?
I'm good.
Probably say one thing.
Okay, go ahead.
For all the Lakeville citizens watching out there, definitely, as much as we reach out to you guys, reach out to us. Take the initiative to have an interest or learn about what we do, what our job entails, and all the things that we do to serve you guys. Because we genuinely care about you, and I'm sure you care about how we are serving you. So feel free to reach out to